Now, Honorable Minister, the coronavirus causes flu. Earlier, the Commissioner of Health in Lagos, while monitoring the Italian man, who is the index person in Nigeria, said the man did not have the respiratory complications, which is some of the symptoms that has been given by the WHO. Does it mean not all the coronavirus cases end up with cough and catarrh as symptoms?
Yes, that's correct. Not all of them end up with cough and catarrh. The coronavirus, as you know, is new, and that's why it's called the novel coronavirus. And the behavior is not yet fully understood, and the way it attacks humans is not yet fully understood. But of recent, scientists are beginning to gather that a large number of people who may have contracted this virus may not even be sick at all. As many as 80% of those who it is estimated they got the virus had either no symptoms or very light symptoms. And 20% are the ones who fall really ill, and 6% fall critically ill. So the symptoms that you usually expect of fever, cough, catarrh, sore throat, respiratory problems, difficulty in breathing, will be present or not present or present in varying degrees.
But does it always have to be within the 2 weeks incubation period that we've heard about?
Yes. As far as we know, the incubation period is 2 weeks, 14 days, during which symptoms will show, they will emerge. And generally, if you don't see those symptoms within 14 days, then it means either the person didn't have the infection or had it but didn't suffer under it. Maybe his physical immunity took control of it.
How about a situation where some people say that some are able to resist the virus because their immune system seems to be stronger than others? How would you react to this?
Well, I won't say the immune system is stronger. It would mean that they probably have antibodies in them which are able to neutralize the virus. And that how they get the antibodies will be a matter of speculation right now because science still has to look into it. It's possible that they have made contact with a virus of similar composition, and they therefore, without knowing it, had developed an immune antibodies or an immune system that is able to resist it. That is still speculation. That is not yet clear. But what is beginning to emerge is that up to 80% of the people who may have contracted, have contact with the virus, may have no symptoms at all, or just a slight fever, or just a slight headache, or a little bit of cough, and then nothing else.
Okay, let's talk about the index case in Nigeria. That is the Italian who came into the country about 2 weeks ago. How is he faring? What's the situation right now as we
He's doing
speak?
very well. He's doing very well. He's being very well treated, and he's responding to treatment. The symptoms are beginning to recede. The cough is, he had a slight cough, it's less, the temperature is almost normal now. And in fact, in Lagos, they also measured his viral load. His viral load is reducing. So it looks like he's going to be all right within a few days.
Now, people are curious to know why his identity is yet to be known. We seem not to know who he is. Is there a particular reason for this?
Yes, there's a reason. And the reason is that we are all bound by what we call medical confidentiality. If somebody is sick, it is not the doctor's prerogative to go and reveal his sickness and his name to the public. That is not the practice. And I'm sure you won't like that to be done to you either.
No.
If you were sick and you went to the hospital and then the doctor will go announce your name and the problem you have. So the confidentiality rule is that you don't do that, except maybe the patient agrees, and otherwise you don't reveal people's identities. And in fact, it's against the ethics.
Now, he was on board a flight to Nigeria that had over 100 passengers, about 150 now. Um, are the co-passengers of the Italian on that airline being monitored, and what is the situation right now?
We have we have experts, epidemiologists who go around doing contact tracing. That is their work, and they are very good at it to trace the contacts where they are, use the phone numbers, and so on. And at least 78 have been tracked. They are being monitored. They are kept under self-isolation in their homes. And apart from that, there are about 20 were found known contacts in Lagos area and about 40 in the Ogun State area. They are also being monitored, and we are in contact with them every day to see how they are doing for the incubation period of 14 days that we have set.
We are made to understand that there are details they usually give on arrival, and that these details are being used to monitor them or to track them and so on. How effective has it this strategy? How effective has it been?
Every passenger entering Nigeria now gets a self-reporting form where you give not only your name but your phone number and a contact address and a contact next of kin. And you're also given a number, an emergency number that you will call. There are people who are there 24/7 to take your call. The rule is that if you have any kind of change in your body, if you feel unwell, if you have a fever, you call that number. And if you do not call, you will be called until the 14 days are over. So it's effective. It's a very useful tool. We have had to design and redesign that form so many times to make it more precise. And we are now able to, in fact, get a list of countries we visited within the last 3 weeks. We extended ours from 14 to 3 weeks just to be on the safe side. So if you visited any country in the last 3 weeks, we take note of that, and you subject that particular passenger to secondary screening if they came from what we call a high risk or high burden country.
Okay. Now, 21 days is the appropriate number of days for the coronavirus quarantine, as we've been told. Now, from February 28 till now, can we say it's too early to tell if the contact person's been observed or negative?
The recommended period is 14 days, not 21. But we just add a few days extra just to be on the safe side.
Okay, to be sure.
Yes, but the recommended WHO recommended period is 14. We stick to 14, but many times we also extend it a little bit just to be on the safe side. And during that period, symptoms should emerge. And if they don't emerge, it means that, as I said, either he didn't get it or the virus did not manifest in symptoms in this person.
Airports in around the country seem to be the area of concentration. Are there arrangements to also monitor land borders effectively to avoid the entrance of this virus? What's the situation on land borders?
This outbreak started in China, and from China it has spread to several other countries. It doesn't seem like it's a virus that is indigenous to Africa, or to Nigeria at least. So the putative point of entry will be that passengers carry it by air. Passengers arriving by air. So we do not rule out land borders. I also do not rule out sea borders. In fact, there are also ships coming in, many ships coming in from China every time. The journey probably takes about 3 weeks. During that time, if anybody had it within the 14 days, they will fall so sick, and the ship will have to report immediately that somebody is sick. So we'll get a hold of that. But we think that 95% by our own rough estimate of the risk will be by air. Passengers who are coming in, traveling by air. So we look at our international airports. I want to emphasize that. Okay. Not every airport.
Okay, international.
Only the international airports. Foreign arrivals here. As I said, it's not an indigenous virus. So our 4 active international airports right now are Abuja, Lagos, Port Harcourt, and Kano. Enugu is closed for repairs, but it will come on stream again very soon. So we are including them in our monitoring scheme. And the first line of defense we have is the port health services. They are the ones who operate the thermal cameras, and they are the ones who have provided the self-reporting form, who scrutinize it. And we work very closely with Immigration and Border Patrol. We had interministerial meeting twice already, where the collaboration between immigration and customs And in fact, the security services has been pronounced so that they help us in screening patients, screening passengers. So if an immigration officer notices someone who's not looking well, they will report immediately to Port Health.
So they've been properly orientated on what to do.
They have been properly orientated. We have had these meetings 2 times with the head of immigration or his representative, and the same thing with the head of customs. So we're all on the same page, and they are aware that we were doing task sharing, and they help us. We help them in various ways.
Now, it's quite interesting and cheering news that the recovery rate, is not too bad, because most people believe, or as it is, that there's no cure for the virus. Out of over 93,000 cases of infections worldwide, about 60,000 recovered. We hear, and like I said, there's no confirmed case and a confirmed cure for the disease. Now, what is the medication being administered to those who have tested positive?
The news about that is that this coronavirus infection is not as deadly as people think. On the other hand, it's a disease that spreads so rapidly and so easily that a large number of people can become infected in a very short time. So that is the main scare about it. But the fact that so many people recover is encouraging. There are scientific evidence. There is scientific evidence that up to 96% of those who contract the virus will recover from it. So the hope is very good that you get a virus, you recover. The main emphasis is on prevention, but if you have to treat, the main treatment is supportive treatment to make sure they don't dehydrate, that the fever is under control, while the body builds antibodies against this virus. Because it's new, you don't have a real treatment for it, but the Chinese embassy shared with us the treatment protocol that they use, which we have circulated. And some doctors are using antiretroviral drugs. There are others which are being experimented with, but I believe that with time, with scientists working as feverishly as they're working now, they'll begin to develop and settle down on drugs that work. This is the main duty of the World Health Organization. They handle this. They have the experts, they have the experience, and then they have the track record for looking after diseases of global concern, and begin to crystallize out what works and what doesn't work. Because at this time, people try many things, and there are a lot of people who claim that they can cure it, even when they have never seen the virus, and people who also claim that they know the answer or the cause. But to filter through all of this is the main job of scientists, and the World Health Organization has a good team of scientists.
Yes, that was taking me to the next question. Last Monday, the former IDEC chairman, Professor Morris, who claimed to have developed a cure for coronavirus since 2015. That's even 5 years ago. What is the federal government's position on this claim? And are there plans to verify his claim, to even take it to the international community as well?
Well, that statement was clarified yesterday by the Minister of Science and Technology. Morrissey, who didn't claim to have found the answer to this coronavirus. What he said was that they had developed something that would be able to neutralize the SARS virus. Some years ago there was an outbreak of SARS, severe acute respiratory syndrome, that he had at that time developed something that could control that SARS, and he was speculating that if that substance could now be adapted to also control this COVID-19, because the COVID-19 and the SARS have viruses that are similar. They are not identical, but they are similar. So the speculation is if that particular substance he developed worked against SARS, then it might work against coronavirus.
Now, yesterday there was a rumor that 4 persons have been quarantined in a hospital in Gwagwalada here in Abuja. The rumor has been debunked. How much information are you putting out to check the spread of rumors, fake news, and so on?
Well, we're trying a lot. That's why I'm here now, to try and dispel the fake news and information and misinformation and disinformation that might be going on. We go on TV, we go on air to present the facts, the true facts, the right message to the public, so that the adventurers and other mischievous people don't begin to cause panic and fear in the population by telling wrong stories. We are doing that. We are trying to keep the public well informed to reduce fear and panic. There's no need for fear, there's no need for panic. You must have the correct information so that you are guided in the proper way.
Now, just it's difficult to avoid hearing these things. It's quite because so much news is flying everywhere. Some have said that if you take alcohol, or if you apply alcohol to the body, you will be protected from the virus. Is this true? Is this true, sir?
Well, when I came in here just now, you gave me some drops of alcohol on my hand to rub on my hand.
Sanitizers.
Thank you very much. Now, the sanitizer contains alcohol, generally 70%. So it works on surfaces. So if you have that on your hand or on the, especially when you are meeting people or touching anything that might be infected, it's a good thing. And you know that if you go to a hospital, you are getting an injection, it is first of all disinfected with an alcohol-based substance. So that the use of alcohol for disinfection of surfaces is not a new thing. It's very old. It's done standard in all hospitals as is a background of a sanitizer. So yes, alcohol works on surfaces and so on. But if you drink it, I'm not sure
Consumption
that
is what I was going to ask you about.
You should have a better excuse to drink alcohol,
And
not Corona.
this. All right, thank you very much, Honorable Minister. Now, people are encouraged to undergo self-isolation, especially when they feel they are exposed. Is there a mechanism to monitor them, and what are they expected to experience as they go through this period?
Well, we don't encourage them to go into self-isolation. We require them to go into self-isolation if they have been in a high-risk country, so as not to endanger, first of all, their own family, their own children, their family members, and keep away from the public, not because they are infected or because they are sick, but because we do not know their status. And if they turn out to be positive, which is extremely rare, then they would not have endangered many people. But the more likely thing, 99% turn out to be negative, and then they can go. But it's just a precautionary measure. It's just a safety measure to prevent your family, your friends, and so on from possibly getting it, if in case you carried it in unknowingly. And it shouldn't be regarded as a punishment. It is not. It shouldn't be regarded as anything negative, and it definitely shouldn't be interpreted as if you came with the disease. Doesn't mean. So, self-isolation at home is one thing. Medical isolation in a hospital is a different thing, which means that a person has been infected, he is under medical isolation. That's a different thing altogether, where he's being treated.
Now, Honorable Minister, there is something that seems to be confusing for many Nigerians. You hear people use these two words interchangeably: isolation, quarantine. Is there a difference, and what is the difference?
Well, people use them interchangeably, and to a certain extent, they can be interchangeable, but they have roughly the same meaning. But generally, quarantine means that you take a person, or even sometimes an animal, because you can quarantine animals too, who come into a country and may or may not be carrying a particular kind of germ. And you keep them in a place away from others for a period of time within which you know that suspected disease would have developed. Which means quarantine means you don't know whether they have it or not, whether they have the disease or not, but you want to be on the safe side by keeping them away from the public first. Okay? They even do it sometimes with plants. But the idea of quarantine must be understood as not be misunderstood as meaning that somebody is sick or he has got an infection. It's a precautionary measure. Now, the isolation, like it's for an infectious disease, as a medical isolation, someone is kept away. It's something a measure you have to take if someone is infected with a disease that you do not want to go into the public. And it's not only coronavirus, we do it for TB, tuberculosis, we do it for Lassa, we do it for a series of diseases which can be easily transmitted from human to human. So for human to human diseases, it was done with Ebola, done with Lassa fever. As I said, any disease that can easily jump from one person to the other. So that's the medical isolation.
Now, the Senate President, alongside some other members of the National Assembly, uh, recently did some investigation that we didn't have a major isolation center in this part of the country or a functioning one. Are there plans to find a solution to this?
Well,
Are there arrangements on ground?
the Federal Ministry of Health exactly was building a standard and very nice isolation center since last year at the University of Abuja Teaching Hospital. And it was supposed to be completed next month in April. So this disease, COVID-19, came up just before this center was completed. Not because we knew that it was coming, but it was being prepared as part of the strategic plan to respond to any disease outbreak in this area, this part of the country. But the outbreak now triggered a situation where we did two things. First, we requested a contractor to accelerate construction on the isolation center. And then we asked Gwagwalada University Teaching Hospital, University of Abuja Teaching Hospital, to provide us with a space right away that we can use now. So we took over the intensive care unit, the ICU, which they had built, and that's what we converted right now to temporary use before the main infection disease hospital is ready. And that place has been we have the furniture in there, it's been equipped, the air conditioners are there, they are being installed right now as I speak. And it's just that this outbreak caught us off guard, and that off guard made it look like we were not ready. And whereas this infectious disease hospital was being constructed long ago. So the temporary building we have now will use for about 2 months or so until the standard infectious disease hospital is ready. And this one is being adapted to serve the purpose of an infectious disease hospital for the time being.
So, what's the capacity of this facility?
It's about 6 beds, but it's expandable. You don't want to have something larger than you really will need. Staff have been trained. We have call-up staff. Call-up staff means that the staff of the hospital who are trained to work in an infectious disease hospital. Good number of them are trained. They are prepared. They are also tested, and they continue their normal work. Now, if you get a patient, you call them up. Those are the call-up patients. Call-up staff. They're not just sitting down there when you might not have anybody in the IDH for months or years. So there are call-up staff that you bring who have been trained to man that hospital.
Okay.
In the meantime, we have nearly half of the number of primary healthcare centers that we want. We have about 4,800. We have recently created a new plan for the design of a primary healthcare center. We have changed the design to update it and upgrade it. Primary healthcare center must now have quarters for staff.
All right. Honorable Minister, I'm sorry to interrupt you. Let's just take a few calls from Nigerians. Hello? We have a caller. Hello?
Hello. Good morning, Olayemi.
Yes, good morning.
Good morning to the Honorable Minister.
Good morning.
Thank you so much. I so much appreciate it. My name is Fiasi Otunbiofa. From Benue, and I'm calling in Abuja right now this morning.
Okay. Go ahead, please.
Okay, thank you. My worry is about the isolation center. And I heard Olayemi made a comment about the capacity. I'm concerned about the capacity. Having known that viruses are ubiquitous, that is, they are found everywhere. and you never know when somebody will stroke down and will be thrown into isolation center. So the main challenge now Nigerians need to tackle is about putting on the right strategy. One, we need a unified data system where we can know people who have traveled out of the country and those who are coming into the country. When that is being done, at least this will be curtailed. We can never have the issue so alarming in Nigeria here. And again, I want to know. Hello, sir.
Make it brief, straight to the point, please.
Okay, I'm going. The minister understand what I'm saying. And again, I want to extend this call.
We're waiting for the question.
Yes, just go straight to the point. We don't have much time.
Okay, it's about the carrying capacity. It needs to be expanded. And I wish to extend this call to the state governors that they should also provide more isolation centers. Thank you very much.
All right, thank you, Fiase Mutum.
Well, we have in Nigeria experts we call epidemiologists and public health experts. They are people who are trained in that line of duty. They monitor diseases, disease patterns, and behavior of diseases. The only thing about the
Hello.
Hold your thoughts, Honorable Minister, just for a minute.
Hello, good afternoon.
Yes, good afternoon. We can hear you.
Good morning, Honorable Minister.
You have 1 minute. Please go straight to the point.
Thank you. When my name is Comrade Ogbanago Mohammed Ibrahim, calling from Ikeja.
All right, go ahead, please.
When Patrick Sawyer came to Nigeria with Ebola from South Africa or somewhere, we were all informed of his name and where he came from. Why are this name not being published? Or is it because Patrick Sawyer is an African man or something? Please, we need the name of this man and let us know the truth of it.
All right, thank you, Ogbanago Ibrahim. Hello? Hello? Yes, hello? All right, I'm sure our callers are still trying to reach us. We have so many coming in at the same time. Yes, Honorable Minister, you were talking about the capacity and training of staff for these isolation centers. That's reaction to Fiase Mutum. Then we'll get to that of the last caller.
Well, let me answer the last one because it's very immediate.
Fine.
And I already answered that question, that you do not reveal a name of a patient and his disease without his permission. There is medical confidentiality, which you do not do. In the case of Patrick Sawyer, he had passed away, and once he passes away, the assumption is that you can now reveal, of course, with the permission also of the family. But in the case of a person who is thriving, you don't just call his name. I'm sure the caller also would not like if you go into a hospital with one ailment and then someone goes on air to announce your name and the ailment you have, because it doesn't work well in society.
I beg your pardon, Honorable Minister. Just hold your thought. Let's take this call. Hello. 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 Tell us who. All right. Hello. Tell us who you are and where you're calling from.
Hello?
Yes. Tell us who you are and where you're calling from, and go ahead. Please make it brief. You have 1 minute.
Hello?
Yes, we can hear you. Go ahead, please.
So, yes.
All right. Go ahead, Honorable Minister.
Well, to complete the question, the question I was answered before, the medical confidentiality does not allow you to announce the names of patients anyhow without their permission. And again, sometimes you also ask, what do you want to do with the name? Of course, Patrick Sawyer has gone into the books now as having brought in that Ebola, but what other purpose had it served? And if you know the name of this person, what do you want to do with it? The fact is that it's a person, and he has his own rights to his own dignity, to his own privacy. And the fact that he brought it in here is not his own fault. He didn't calculate it to bring it here. Now, to go back to the primary healthcare center, we have, to the isolation center it is.
Hold your thoughts, Honorable Minister. I'm really sorry. Let's take this one call again. Hello?
Hello?
Tell us who you are.
Hello? Hello?
Tell us who you are, where you're calling from, and please go straight to the point.
Yes, my name is Umar from Katsina. Hello?
Your
Yes,
question,
go ahead.
please.
We can hear you. Go ahead, please.
Okay, my question is it possible for someone that is negative with the disease to take a person that is positive to the hospital for confirmation? That is my question.
Oh, sorry, we didn't get that. To somebody who is negative with the virus,
Yes,
to do what?
to take someone that is positive to the hospital for confirmation, or to ensure that the person is positive.
Okay, maybe he's talking of
That's
safety.
my question.
I think he's talking of safety now, in terms of taking someone who is infected.
Yeah,
to the
but you will
hospital.
not know who is infective unless that person has been tested. You have no,
fine.
you have no way of knowing that. And so, if you have someone who you suspect of having symptoms, you suspect, the best thing is that you call the numbers. That's why the numbers have been given to you, and not to physically decide that you take that person to the hospital or force that person to go. So you call the authorities, call the Nigeria Center for Disease Control, and the person will now be interviewed. And the first thing we'll do is, did he travel out of the country within the last 2 or 3 weeks? If he never traveled out, then he's unlikely that he will have contracted it. And if he never traveled to a country with a high burden, or even with any case at all, then it's not likely. So it's not everybody who can pick up somebody and drag them to the hospital for testing. You have to have a good reason and then call the Center for Disease Control. They will interview the person and then decide what they will do, whether they pick him up or invite him for testing.
All right.
And testing is what confirms that the person has the disease.
Hello, good morning.
Hello, good morning.
Yes, tell us who you are, where you're calling from, and
My name is Victor, calling from Metama.
all right, make it brief. Please go ahead.
My question to the Honorable Minister is, since this case is already in Nigeria, and Nigeria is a country with high population, so what the form of tackling this case, such as you know that in schools, markets, churches, they are crowded, and this disease is being passed easily. So what's the form of tackling these issues?
All right, thank you very much. Hello, Victor. Okay.
Hello?
Have you been listening?
I'm listening.
All right, thank you. Please keep listening. I'm sure he'll react to that. Hello? Hello? Okay. Honorable Minister, let's continue from. You were going to talk about the isolation center, or would you prefer to react to these issues raised first?
Right, let's finish isolation
Okay,
center.
for once, yes.
I was answering that question that we have public health experts, very many of them, well trained with international experience, and epidemiologists who advise us on how many isolation centers we need, what they should be, how they should be designed, and how large they should be. This is not a subject for people who have not really actually studied it to suggest how it should be like or what it should not be like. So, and we listen to these people. I am in touch with epidemiologists, with the head of the Nigeria Center for Disease Control. Almost every hour we're talking, and he's briefing me on things that are developing. And we'll keep asking. And we're also developing plans. If we have a large large incidence, a large number of people become sick, what do we do? We've already got a plan B, and we have a plan C of what we shall do in the meantime. But if you build an overcapacity of isolation center, it lies waste and empty, and that is not what we want. We don't have money to waste.
I beg your pardon. Let's just take this call. We have another. Hello? Hello? Are you there? All right. Now, there's this question we would like to know. Recently, President Muhammadu Buhari commended the Aliko Dangote Foundation for donating 200 million naira to assist in combating the influx of COVID-19 into the country. Are there plans to utilize these funds to provide free sanitary relief materials like hand sanitizers, soaps, masks, and so on to the grassroots at little or no cost at all?
Yes, even the government itself, President Buhari himself, has made almost 1 billion naira available for battling this disease. But what we must know is that the extent of it is not yet very clear. How large it's going to get, we don't know. Some countries are in, you can see, beginning to take some emergency measures like banning public events and closing down schools. Those are countries where this disease is spreading very rapidly. And those are even countries with very strong health systems. We know the strength of our health system here, and that's why our own strategy is very, very strong on prevention. We have a stronger prevention strategy than many other countries. And if you talk to our Nigerians who've gone abroad to other European countries and who have come here, they will tell you the difference between the prevention strategies we have here and what they have seen in Europe and in even developed countries. We have a very powerful, very strong prevention measures because we don't want these germs to come in here in the first place, so that we don't have to deal with it. The other caller who made a question about the high population is quite correct. That's one of the main reasons. If you have a large population, you run the risk of easier spread. So but we are not panicking yet. We have developed a strategy to advise major churches and that state governments to advise major churches to also start looking at using sanitizers in their churches, and beginning to take measures for hygiene that will protect the citizens, particularly when you are doing things like communion and so on.
Okay, let's. We have more callers on the line. Hello, tell us who you are and where you're calling from.
I'm coming from Agwalada, Amadikona.
Gogwalada?
Yeah.
Tell us who you are and then go straight to the point. Please make it brief.
Amadikona from Agwalada. Good morning.
Good morning.
Please, as a layman in the medical field, how can we identify somebody who is infected so that we can be able to scare ourselves away from him?
All right, thank you. Is that all?
Yeah.
All right, thank you very much. Yes, Honorable Minister.
Let me remind you again that this is an imported disease. You are not likely to be finding people walking around your streets with COVID-19. But if you are requested to help in contact tracing, the public health officials may contact you and say, look, we are looking for so person who was a contact of the index case and we are told lives in this area. That's where you can help. But it's not for citizens to think that they will find somebody who's infected in the streets and pick them up. That's not the way we expect this disease will spread. It is through contact from person to person, from person who had it, who brought it into the country or connected to that person, that we call primary infection, and then also possibly secondary infection. So you can help by listening to requests by public health officials, where you can help to trace and track people who have been to high-risk countries.
What of money? Recently, the World Health Organization, the WHO, said handling of cash could put one at risk of contracting this virus. The weather in Africa and the black skin have also been rumored to be an advantage to black Africans.
There are a lot of rumors that are going around. Most of them you have to take with a pinch of salt until they are confirmed by experts. I said before, we have public health experts, people who know how diseases spread and how disease germs behave, and who advise on what to do. The most important general measure that you can take is frequent hand washing. Also, wash your hands frequently.
Aerosol infection, I think, is also one of the issues mentioned. Aerosol infection?
Aerosol infection?
Yes, I don't know.
Well, good. I mean, it's believed that when people cough or when they sneeze, they release particles of droplets into the air. That's the aerosol. And these droplets contain the viruses which might infect you. Anybody who is in that proximity. That's why we also talk of what you call a social distancing, believed to be about 2 meters. So if you are 2 meters away from someone and they cough or sneeze, you are less likely to get that droplet in you. So those are issues which are protective in nature.
All right, hello. Let's take this call. Hello.
Hello, good morning.
Yes, good morning. Tell us who you are, where you're calling from, and go straight ahead. You have 30 seconds.
Thank you very much. It's Pastor Eric. I'm calling from Refuge.
All right, please go ahead.
That is just Plateau State.
Okay.
My question is on Naira notes, because I heard in the news that they are sanitizing, some countries of the world are sanitizing the notes, Naira notes, or dollar notes, or any other currency. I don't know what our own country is doing concerning that, so that our Naira note can be sanitized, so this virus will not be spread through that medium. Thank you very much.
All right, thank you very much, Pastor Eric. Yes, Naira notes, I think we discussed that earlier, but maybe
Yes,
for the sake of emphasis.
we discussed it. What I also wanted to say was that if you have the habit of frequent hand washing and using sanitizers, you are generally going to be safer than those who don't use sanitizer at all.
Okay. All right. Now, let's talk about the flight once again, which the Italian took when coming to Nigeria. Now, 49 people were contacted, 149 passengers in the airline, 84 residents are residents of Lagos, 35 offered wrong information and have not been reached, 65 traveled beyond Lagos, and so on. With these figures, with these numbers, what's going on to make sure that we're safe?
Yeah, as I said, we have experts in tracking, contact tracing, and these are epidemiologists. They know what to do. They go from one house to the other, and that is where that caller who called before can help and say, okay, you are looking for some person, they used to live here, they have now moved to this place, you can help. Also, if you know somebody who traveled to China recently, and you are sure he traveled in the last 2-3 weeks, and you think you see him looking sick, you can also either call or advise him to call.
Okay, as simple as that.
Simple.
Okay, but the airline involved now, has there been any reaction from them? Are you cooperating with them? Are you working with them?
But yes, of course, these are all requirements. In the first place, if you have a problem like this, you have to inform the World Health Organization. Okay. And at the same time, you inform the airline itself and say, this is what we found. We discovered that one of the passengers you brought is positive for COVID-19. We are tracing the passengers you brought, but you have to look after the crew that was in the plane. So that country and the airline will know what to do. They follow international health regulations. We have international health regulations which are laid down and which people follow. And they are the products of best practices and of scientific studies. So you just follow those rules. WHO, World Health Organization, provides the guidance for everybody.
All right, our time is fast running. Can you give a general advice to Nigerians on how to stay safe and ensure that virus like this don't spread? And that is also remembering that we also have a challenge with Lassa fever. I wish we had more time. We will have looked into that as well. But give a general advice to Nigerians.
Number one, no panic, no fear. Don't start losing sleep over the fact that you might suspect that you have a coronavirus everywhere. Number two, keep general personal hygiene and domestic hygiene and food hygiene. Wash your hands regularly with soap. If you have sanitizers, use it frequently. There are people who have sanitizers in pocket now. Nigeria is already producing a lot of sanitizers. And some medical companies, pharmaceutical companies are producing sanitizers. Use sanitizers many times. Then keep social distancing. Avoid crowds. Avoid large collection of people, especially when you see there are people there who have fever or who have cough or who are going to seek healing. And that it not only helps with regard to coronavirus COVID-19, it helps even to ward off TB, because TB is spread by a similar method, by coughing and sneezing into the air which people breathe. That's the way tuberculosis is spread
as well.
So a lot of disease patterns which can spread that way will be helped if we take these measures. And then social distancing. If someone has a very nasty, persistent cough, then you make sure you're at least 2 meters away from them, or if possible, to leave that place, or advise them to go home.
All right. Honorable Minister, we wish to thank you so much for coming on the program. And that's how we can go on today's edition of Have Your Say.